Are you from Tulsa?
Originally, I was born in Claremore.
Who would have thought that in the heart of America, where the skies stretch wide and the plains seem endless, you'd find people sleeping under bridges, wrapped in torn blankets instead of warm beds? This isn't just a story from the coasts. When tents begin to line the sidewalks of Oklahoma City and Tulsa, it becomes clear homelessness doesn't discriminate by geography. Beneath the soft dawn light and the quiet sway of prairie grass lies a different Oklahoma, one not found in postcards or political promises. For decades, the struggles have been buried under red dirt and overshadowed by oil rigs. Communities across the state have wrestled with limited resources, outdated systems, and the painful challenge of guiding people back to stability. Yet the deeper reality, the scale of the crisis and the humanity behind it, often goes unnoticed until you stop and really look. This isn't a story of blame. It's a story stitched together by policy, economics, and survival. In this video, we'll unpack the numbers, trace the roots of the crisis, and share the real faces behind Oklahoma's homelessness problem, because understanding it is the first step toward changing it. If this perspective matters to you, please like, comment, and subscribe. Your support helps bring untold stories like this into the light. Current situation. Rolling into downtown Oklahoma City, you're met with a glittering skyline of office towers and glass-walled condos. But just a few blocks east, the story shifts. In the 2023 point-in-time count, HUD recorded 4,650 people experiencing homelessness across Oklahoma, a 12% jump from 2022. Of those, nearly 2,962% were unsheltered, sleeping in tents, vehicles, or on sidewalks, a 15% increase over the previous year. Families with children numbered 1,050, up 20% from 2022, while youth under 25 accounted for 600 individuals, climbing 18%. Veterans made up 310 of the unhoused population, an 8% rise, and chronically homeless persons, those without housing for at least a year or repeatedly, totaled 2,420, or just over half of all cases. Over in Tulsa, outreach teams counted 1,389 individuals on a single January night, with 850 unsheltered, a 10% rise, and 539 in emergency shelters. Smaller cities haven't escaped the trend. Norman saw a 14% uptick, Lawton 18%, and Muskogee 22% in unsheltered counts. Even rural counties report makeshift camps along back roads. Service providers estimate more than 150 informal encampments statewide, each housing between 5 and 40 people. Shelter capacity is stretched thin. Oklahoma City offers 1,750 beds nightly but receives over 2,400 unique requests per week, leaving hundreds turned away. Tulsa's network of shelters and transitional housing has 1,200 beds, but logged 1,700 calls for help in the first quarter of 2024. Meanwhile, the average wait time for a subsidized housing voucher exceeds 18 months, and more than 3,200 households are on waiting lists for rapid rehousing programs. This travel documentary series on our channel goes beyond the stark numbers to meet the people behind them. The single mother who lost her apartment after back rent totaled $2,400. The student juggling 3 part-time jobs to avoid eviction. The senior who's lived in her car for 8 months. What drives thousands to sleep on sidewalks in a state known for red dirt and rustic charm? Having painted this stark portrait of numbers and faces, next we'll explore the root causes pushing so many Oklahomans to the brink. Causes. At the heart of Oklahoma's homelessness surge lies a shifting economic landscape. Over the past 5 years, average rents in major metropolitan areas have climbed by nearly 25%, while median incomes in many working-class sectors, retail, hospitality, and manufacturing, have barely budged. A waitress earning minimum wage in Tulsa used to spend 28% of her income on rent. Today, that number eclipses 40%, leaving little left over for groceries, medical care, or transportation. How does the sudden withdrawal of pandemic-era support leave families teetering on the brink? When federal unemployment supplements and eviction moratoriums expired, a wave of overdue rent notices swamped landlords and tenants alike, triggering mass displacements that local courts were ill-equipped to manage. Affordable housing stock in the state treads a fine line. Nearly 60% of low-income renters qualify for Housing Choice Vouchers, Section 8. Yet only 1 in 4 actually receives assistance due to funding caps and lengthy waitlists. Developers cite narrow profit margins and zoning hurdles as barriers to building new units, especially outside downtown cores. In some counties, less than 5% of rental listings cost under $800 per month, a threshold that would allow a full-time minimum wage worker to afford a modest one-bedroom apartment. Meanwhile, the oil and gas sector, a historic pillar of the Oklahoma economy, has hummed with fluctuating fortunes, drawing in transient workers and fueling competition for rental properties. Beyond housing economics, mental health and substance use intersect dramatically with homelessness. According to the Oklahoma Department of Mental Health and Substance Abuse Services, nearly 18% of people experiencing homelessness in 2023 reported serious mental health conditions, and over 30% battled chronic addiction. With many rural counties lacking psychiatric facilities and recovery centers, individuals often cycle through jail, hospital emergency rooms, and street corners without ever gaining stable footing. Will the patchwork of local shelters and outreach teams rise to meet this growing need? Victims of domestic violence also represent a growing segment of the unhoused population. Oklahoma's domestic violence shelters operate at full capacity more than 70% of the year, forcing some survivors and their children into unsafe, informal housing or back into the communities where they fled. Legal advocates point to long wait times for protective orders and limited safe housing options as root factors that prolong trauma and contribute to chronic homelessness. Structural issues, historic underinvestment in social services, persistent poverty in rural counties, and limited public transportation compound the crisis. In places like Pottawatomie and Garfield counties, households living below the federal poverty line have hovered around 16% for the past decade, yet state funding for supportive services has lagged behind population growth. Without reliable bus routes or day program centers, many find themselves stranded miles from job opportunities, food banks, or medical clinics. In crafting this travel documentary narrative, we've seen how a convergence of rising rents, evaporating support systems, and fragmented public services have created a perfect storm. Ultimately, this travel documentary approach highlights that homelessness in Oklahoma is neither a moral failing nor an isolated phenomenon, but the outcome of policies, economic shifts, and social gaps that demand comprehensive solutions. In the next section, we will explore the social welfare programs designed to support those experiencing homelessness in Oklahoma. Social welfare safety net. In this travel documentary segment, we shine a light on the patchwork of programs designed to catch those who fall through the cracks. Across Oklahoma, nonprofit shelters, faith-based organizations, and municipal outreach teams form the front line of support, offering beds, meals, and basic hygiene services. Agencies like the Regional Food Bank partner with street ministries to distribute hot meals and care kits, while organizations such as the YWCA and Catholic Charities operate emergency shelters with capacities ranging from 50 to 150 beds per night. The state's Medicaid expansion has extended health coverage to thousands, including behavioral health services essential for individuals grappling with mental illness or substance use disorders. Yet capacity remains tight. Recent estimates suggest that fewer than 60% of those who qualify for assistance actually receive it, due in large part to funding shortfalls, volunteer shortages, and bureaucratic hurdles. But how many who turn to these safety nets leave with a path forward, and how many simply circle back to the streets once the clock strikes morning? Beyond beds and meal lines, transitional housing programs aim to bridge the gap between crisis intervention and permanent stability. Models like Housing First prioritize immediate placement into stable housing without preconditions, linking clients to wraparound services such as case management, vocational training, and addiction counseling. The Oklahoma City-based Mental Health Association's Permanent Supportive Housing Initiative reports that over 90% of its participants maintain stable housing after 1 year, a figure that outpaces traditional shelter programs by more than 30%. Still, funding caps limit slots to under 500 statewide, far fewer than the thousands on waiting lists. This bottleneck creates a revolving door effect. Individuals exit one program only to re-enter another, never fully escaping the cycle of homelessness. Rural outreach poses its own set of challenges. In counties like Garfield and McCurtain, where populations are sparse and distances vast, mobile clinics and satellite food pantries play a crucial role. The Meals on Wheels style delivery of food boxes and medication to isolated seniors prevents many from needing to relocate to shelters in larger towns. Faith-based groups, often the only source of local support, rely heavily on volunteer networks that can dwindle during planting or harvest seasons when rural residents must focus on their own livelihoods. This ebb and flow of volunteer availability means that consistent service delivery is hard to guarantee. Children and youth experiencing homelessness represent one of the most vulnerable cohorts. The Tulsa Public Schools reported over 200 students classified as homeless during the 2023 to 2024 academic year, a figure up 18% from the previous year. Under the federal McKinney-Vento Act, these students are entitled to free meals, transportation, and immediate school enrollment, but stigma and frequent moves still disrupt their education and social development. School liaisons often scramble to locate stable housing or shelter beds before classes begin each semester, a race against time that too often ends in temporary arrangements or couch surfing. Veterans make up another significant portion of the unhoused population. The Oklahoma City VA Medical Center has expanded its supportive services for veteran families (SSVF) program, offering rental assistance and case management to prevent homelessness among at-risk veterans. While evictions among veteran households have decreased by 15% since the program's inception, the demand continues to outstrip supply, and nearly 400 veterans remain on waiting lists for rapid rehousing assistance. The Social Welfare Network in Oklahoma is a testament to community resilience and interagency collaboration, but the system seems to show strain at nearly every junction. As these support networks stretch and strain, the next section will explore how government agencies are stepping in with new strategies and investments. Government solutions and policy initiatives. Another chapter in our travel documentary narrative unfolds with a closer examination of the state and local government's responses. Oklahoma's Department of Human Services, OKDHS, administers federal funds such as the Emergency Solutions Grant, ESG, and Continuum of Care, COC, programs, funneling millions annually toward emergency shelters, rapid rehousing, and homelessness prevention. In FY 2024, OKDHS reported allocating $8.3 million in ESG funds to 23 municipalities and nonprofit partners, enabling over 1,100 households to avoid eviction or secure transitional housing. Yet the question remains, what does it take for these policy dollars to transform into actual homes and sustain stability? At the municipal level, Oklahoma City's Key to Home (OKC) initiative exemplifies a holistic approach. Launched in 2022 with a $5 million seed investment, the program combines targeted rental assistance, job placement services, and on-site behavioral health support at new mixed-income housing developments. By incentivizing private developers through tax credits and zoning waivers, Key to Home OKC has added 350 units of affordable housing in downtown and midtown neighborhoods, specifically earmarked for families experiencing chronic homelessness. Results have been promising. Chronic homelessness rates dropped by 16% between 2022 and 2024, and job placement among participants rose by 22%. However, given the statewide need that exceeds 4,600 unhoused individuals, scaling up remains a formidable challenge. Can these targeted programs and funding streams keep pace with the accelerating numbers on our streets? Tulsa's City Council has pursued a parallel path, dedicating $3 million in municipal bond proceeds to build a comprehensive shelter campus with 200 beds, integrated health clinics, and workforce development workshops. The Tulsa Housing Solutions bond passed with bipartisan support, signaling a community consensus that homelessness is not merely a personal failing but a shared civic responsibility. Yet bonding capacity is limited, and repayment obligations compete with other infrastructure priorities like roads and schools. State legislators have introduced bills to create a dedicated homelessness infrastructure fund, which would earmark a percentage of lodging tax revenue for shelter construction and support services statewide. The proposal has passed committee votes but awaits full legislative approval, leaving communities in limbo. On the policy front, Oklahoma's expansion of Medicaid under the Affordable Care Act has unlocked new opportunities for integrated care models. The Oklahoma Health Care Authority partners with community mental health centers to embed housing navigators within primary care clinics, ensuring that patients at risk of displacement receive immediate referrals to housing programs. Outcome data shows a 28% reduction in hospital readmissions for patients with unstable housing, underscoring the link between housing security and overall health. Despite these gains, provider networks face workforce shortages, particularly in rural areas, where the ratio of mental health professionals to residents falls below national benchmarks. In the legislature, bipartisan coalitions are advocating for reforms to Section 8 voucher administration, aiming to streamline application processes, reduce waiting list backlogs, and adjust income thresholds to reflect local market realities. Pilot programs in Cleveland County allow voucher holders to utilize assistance for homeownership, not just rentals, a novel approach that could help break the cycle of dependency. Early results indicate that participants who purchase homes demonstrate greater long-term stability and economic mobility. But the model's scalability and financial feasibility at a state level remain under review. What happens when these funding cycles end or economic downturns consume budget surpluses? Through these combined efforts, municipal initiatives, state legislative actions, and healthcare partnerships, Oklahoma is crafting a multifaceted response to a multifaceted crisis. With these policy efforts paving a path, let's consider the broader strategies and commitments needed to move forward. Conclusion. As our journey through Oklahoma's homelessness landscape draws to a close, it becomes clear that no single policy or program can solve a crisis born of economic hardship, systemic underinvestment, and human vulnerability. From the tents under highway overpasses to the corridors of the state capitol, every stakeholder, whether nonprofit volunteer, municipal planner, or elected official, plays a vital role in weaving safety nets strong enough to hold those at risk. Yet the true measure of success lies not just in counting beds or dispersing funds, but in rebuilding lives and restoring dignity. Can we as a society commit to sustained collaboration, flexible funding, and a shared vision of housing as a fundamental human right? Only by answering that question with concrete action will the next chapter of this travel documentary move from tales of crisis to stories of hope and renewal.